Hi, my name is Lauren Jarmusz. I'm a doctor of physical therapy at Stanford Healthcare. I apologize for not being able to be on the live feed today, but I won't be able to make the time. I'm treating patients this morning. So I hope that this video gives you a nice clinical insight into how, coming from a clinical healthcare perspective, your development for this Call for Code hackathon can be used to help patients or victims who have unfortunately been part of a natural disaster. So if you're watching this video, you have decided to join part of the Call for Code hackathon to create a technology-based solution to improve healthcare interventions for victims following natural disasters. My role today is to give you insight on the healthcare perspective as a clinician who works with patients who have unfortunately sustained injuries from a physical perspective, but also to take into account the other perspective of other healthcare providers who work with victims of a natural disaster. So, as you've seen in the past news over the past years, it has been well researched that communication between healthcare providers has a drastic impact on the quality of care for patients, the patient's healthcare outcomes, and even prevention of death. If you can imagine, in even the first world countries in the United States, this is a problem. And if you can imagine, after a natural disaster, that communication of care, that coordination between doctors and providers and first responders and police becomes tangled and quite difficult as a traumatic event such as a natural disaster unfolds. So one of the main criteria that needs to occur in one of these developments is hopefully creating a better coordination of care, providing improved access and accurate data to the healthcare providers when needed. Like I mentioned, during a natural disaster, there are multiple types of people working to assist in the situation. Again, from my healthcare perspective, we have our first responders. We have emergency surgery as the patient progresses from the acute immediate danger. They move into physical therapy, rehabilitation. If they sustain any injury, they're going to need to learn how to move and walk again without pain. It's been well researched that after a natural disaster, psychological issues play a major role with people who have undergone such a traumatic event. PTSD, depression, loss of family members, friends. So during a natural disaster, throughout the entire time frame, multiple healthcare providers are working together to provide the best quality of care. And if that communication and coordination between those health records are not there, it makes it very difficult to provide the most effective quality of care for patients. If we take into account a natural disaster, there are many types of healthcare needs, and again, I am just touching on the basic healthcare needs of people, but within a natural disaster, there are multiple units taking place at the same time. From healthcare needs, there's psychological needs, there's acute physical needs, people who need emergency surgeries, people who are having difficulty with breathing, they have a traumatic injury that is life-threatening. Maybe they simply broke a bone or tore a ligament, but acute physical needs need to be addressed. After the initial shock of the natural disaster, chronic physical issues set in. People are dealing with chronic pain. There's an inability to return to prior level of activity because they have been injured. They have to figure out the appropriate medical management and medication usage. And then even all the way down to logistics, from the immediate disaster all the way through months and years after, people are going to have to decide resource allocation, where healthcare records are being sent or saved, how they're going to manage their medication, and coordination of follow-up appointments. So many different healthcare needs are going to be addressed throughout this span of a natural disaster. What I'd like to do to orient you to different solution tracks when you're developing a solution for natural disasters in hopes of improving the quality of healthcare for victims is to break up a natural disaster into solution tracks. The acute track, the subacute track, and the chronic track. At each of these tracks or time frames, the problem to solve is how can you help victims of a natural disaster receive the appropriate care they need at that specific point in time in order to focus your specific solution. It can be very difficult to try to design a solution that will affect each timeline. If you can, I give you lots of credit. Let's do that. But otherwise, I think that separating these solution tracks will be the most helpful for you. Alright, we're thinking the acute phase. This is time frame immediately following a natural disaster, or even during the natural disaster itself. The resources are minimal. You're just figuring out what's going on. Information is not disseminated appropriately. It's chaos. We've got your first responders on the scene. The location is where the disaster occurred, and the typical personnel are your first responders, the victims themselves, emergency triage situation, emergency infrastructure. So this is kind of setting the scene if you're hoping to develop a solution in the acute phase. To make it a little bit more personal, let's give you a case study that we can use throughout the acute phase, subacute phase, and chronic phase. I'm going to read this right off the slide. Feel free to follow along. But Joe, he's a 45-year-old teacher in San Jose. He sustained a traumatic brain injury in an earthquake when a shelf unfortunately fell on his head during the immediate earthquake. He is stuck at work 4 miles from the nearest hospital. He is currently displaying neurological deficits. He's having difficulty with his speech, inability to recall events within the last 5 minutes, asymmetry in his movement, which is indicative of a stroke, and difficulty walking. Important things to know about Joe. He's a type 2 diabetic. He was diagnosed with epilepsy 10 years ago, and he's severely allergic to local anesthetics and latex. Taking this phase into account, my call to action to you is how can you help Joe at this point in time? Chaos is occurring. He needs help. How can you help him? Is there a way to create a solution to better disseminate his information to the first responders when they find him? How can you use technology to improve his quality of care? Looking into the subacute phase, again, we're thinking time frame 8 hours, so even halfway through a disaster, 3 weeks post a natural disaster incident. The resources are still minimal to moderate. You're still gathering support from the government, from the resources around. People are flooding in to help, but they're still moderately restricted. Now the problems are spreading into the hospitals, community centers, temporary housing. People may be displaced, they might not have a home, they may be in a hospital being cared for all this time. The people involved, of course, are the victims, the hospital health care providers, community-based healthcare providers, social workers, volunteers, police, fire department, infrastructure management. And if we're able to pull Joe along this journey, he was able to make it to the hospital 5 hours after his initial injury. He was admitted into the hospital for the last 7 days. He is ready to be discharged to a subacute rehab hospital to continue his rehabilitation. His family is flying in from New York to stay with him, but he has been alone up until this point because his wife was out of town at the time when this natural disaster happened. Because of the natural disaster and the chaos and coordination in his care, his medical records has been scattered and scarce despite his serious multifactorial medical diagnosis. So just like in any area of life, knowledge is power. Joe his practitioners, his doctors, his nurses, his rehabilitation, his psychological counseling if he has it, just to name a few healthcare positions, they don't have the data that they need to treat him appropriately. That is just one example of maybe how technology can be used to improve Joe's situation. Maybe taking into other technological solutions, we're gathering data about the natural disaster itself, if it's still going on, that can assist his situation. Moving on to the chronic phase, we're thinking 3 weeks post natural disaster, just to give an example. The resources, now you have more resources, you're having a financial outpouring to assist with the situation, you have the personnel needed to contain the situation, the location, hospitals, community centers, outpatient medical centers as people start to follow up for their care, schools, people are getting back to work. Life is starting to resume as it normally would, if possible, but people are still dealing with the traumatic incidents of the natural disaster, whether that was an injury, cognitive, PTSD, psychological trauma. They're still dealing with this on a daily basis. Many people are still involved, and we just pull more and more people into the fold in this chronic phase. Let's pull Joe along. He was successfully discharged from the subacute rehab hospital after 3 weeks. Although he was discharged, he needs to continue with regular neurological checkups every 3 to 4 months and weekly outpatient therapy, including physical therapy, speech therapy, occupational therapy, and psychological interventions. Joe has the support of his wife and adult son. However, they are working full-time. And Joe, with his neurological deficits, including speech, movement, and memory deficits, is tasked with managing his care. How can you, with your technology solutions, help Joe improve his care? At this point in time, again, his medical records need to be up to date. He has to find ways to coordinate his care, and now he's dealing with lapses in memory. He's having difficulty getting from place to place independently. He needs help. Is there a way that we could make his life easier from a healthcare technology perspective? So again, I am reaching out to you if you have joined this healthcare hackathon. Our goal is to create a technology-based solution to improve healthcare interventions for victims following a natural disaster. For me, as a clinical practitioner, I really urge you to create a solution focusing on improving the coordination of care, access to care, and quality of care, pulling together interprofessional, multidisciplinary professions to provide the best holistic care for patients who have unfortunately been a victim in a natural disaster. Good luck, and I hope to see the outcomes at our demo day. Have a great day, guys.